Hi, my name is Uzma Zakir. I'm a dispensary pharmacist at The Botanist. Today we're going to be talking about severe rheumatoid arthritis. Rheumatoid arthritis is the most common type of autoimmune arthritis affecting 1.3 million people in the United States. An autoimmune disorder is when the immune system attacks healthy cells by mistake. Rheumatoid arthritis is a systemic, chronic, inflammatory condition that affects multiple joints and can cause bone erosion. In rheumatoid arthritis, the immune system affects the tissue lining of joints. It oftentimes starts with smaller bones and smaller joints, like in the fingers or the toes, and can progress to the shoulders, to the hips, to the knees, the elbows, and the wrists. And this leads to extreme swelling, stiffness, and pain. Rheumatoid arthritis often leads to bone erosion in joints. Bone erosion is the loss of bone in specific areas and is a key outcome measure in rheumatoid arthritis. It is the inflamed tissue around the joints that has an increased number of cells called osteoclasts. And osteoclasts are responsible for absorbing and removing bone. Many RA patients undergo hip or knee replacements because of this. Patients with RA experience pain and fatigue. They can also experience cardiovascular issues such as hypertension or high blood pressure, and oftentimes it is associated with depression. In my experience, many patients report feeling extreme stiffness in the morning, and it can take a couple of hours to get their day started, from struggling to get out of the bed, struggling to make a pot of coffee. Unfortunately, these symptoms can often lead to work disability. Treatment for RA should include anti-inflammation as well as anti-bone erosion properties. How can medical cannabis help with the symptoms associated with severe rheumatoid arthritis? In a previous video, we discussed the endocannabinoid system. Now let's take a look at how it plays a part in RA. The purpose of the endocannabinoid system is to restore the body back to balance, or homeostasis, and reining in a prolonged inflammatory cascade. Inflammation is an important part of our immune system to fight off injury and disease. However, when it becomes chronic, it becomes a very serious problem. It is now commonly accepted that cannabinoids are potent anti-inflammatories. We have treated many patients with severe rheumatoid arthritis since it became an approved condition in the Connecticut State Medical Marijuana Program in 2018. Many patients report an improvement in quality of life, less stiffness in the morning. We like to recommend products at wake up to ease in that morning routine and to reduce stiffness. Even using THC products at night to help for sleep can improve function and symptoms in the morning when the patient wakes up. Patients report better pain scores, less fatigue, more motivation, and a relief in mood and depression. Flare-ups are common in RA, so you can have a reduction in the frequency and severity of your symptoms, but there may be some days that are just harder than others. During flare-ups, we can recommend additional products or an increase of dosage of what you use regularly. Now let's take a moment to discuss the endocannabinoid system and bone erosion, which I found to be particularly fascinating when I was researching severe rheumatoid arthritis. Our cannabinoid receptors, both 1 and 2, are regulators of bone remodeling as part of their regular function. Bone erosion or bone destruction in RA is caused by an increased level of osteoclasts, those cells that I mentioned earlier that are responsible for bone absorption. It is the overactive immune system that causes this to occur on such a debilitating level. In a study done on mice using a synthetic cannabinoid used only for research, it was found that targeting the CB2 receptor reduced osteoclast activity and therefore suppressed bone destruction. Here at the dispensary, the pharmacist will get to know your struggle with rheumatoid arthritis. Many patients are using high amounts of pain medication and still reporting pain scores of 9 or 8. We look forward to working with you to improve your pain score and help you regain your quality of life. Thank you.